Thank you for joining us today for a news briefing of the Unified Command of Jefferson County. Today, you'll hear from speakers who will address topics including an update on where the pandemic stands, where local and statewide COVID numbers are, new information about staying safe and in preventing further spread of the disease, and as well as we have two COVID-19 testimonials, two people here who have their unique stories with the virus to share with you. The speakers will include Dr. Mark Wilson, Jefferson County Health Officer, Dr. Michael Saag, Professor of Medicine here at UAB in the Division of Infectious Diseases, and then Cindy Wisenat and John Jelene Woods, who both have their own unique COVID-19 stories. Speakers will wear their masks up and then remove them when they begin to speak. We'll hold questions. We're going to actually do Dr. Wilson to speak first, then Dr. Saag, then we'll do a Q&A for both of them. Once they've finished, we'll bring up our two guests to share their stories. Now we'll have Dr. Wilson come share his remarks.
Good afternoon. The spread of COVID-19 is getting worse in Jefferson County, unfortunately. Things are moving in the wrong direction, and I'm very concerned. So today, after getting approval from the state health officer and by the authority given to the county health officer to institute measures to prevent the spread of notifiable diseases, including COVID-19, I've signed a face covering order for all of Jefferson County effective 5 p.m. on Monday, June 29th. Per this order, all persons over the age of 8 shall be required to wear face coverings or masks in the following public places in Jefferson County: indoor spaces of businesses or venues open to the general public, including but not limited to stores, bars and restaurants, except when people are eating or drinking, entertainment venues, public meeting spaces, government buildings, civic centers, entertainment venues, etc. Those are indoor spaces open to the general public. Additionally, transportation services available to the general public, including mass transit, paratransit, and ride-share programs and taxi services. Outdoor spaces are not covered by this except for those spaces open to the general public where 10 or more persons are gathered and unable to maintain a distance of 6 or more feet from persons not from the same household. This order shall remain in effect until I determine that public health conditions in the county warrant discontinuation or a change in the order. There are several exceptions in the order. I'll just mention a couple. Places of worship are not covered by this order. They may use their own discretion. However, face coverings are strongly recommended for congregants during worship services, especially while there's congregation singing or speaking, or in situations where people are not able to maintain a safe distance from each other. This order also does not mandate face coverings for our schools. All schools, daycares, and other child care establishments shall develop their own policies and procedures based on guidance from the State Department of Education and other advice from public health authorities. The order will not cover the city of Birmingham, which currently has a face covering order, until that order expires, and then this will cover Birmingham as well. We will require those businesses and venues that are open to the public to post a notice of the face covering requirements on their entrances. We're providing a copy of that notice for them. They can visit our health department website at jcdh.org to download and print the notice for entry signs. It should be very easy to find. You will not have to search for it. Anyone can go to our website, the health department's website, jcdh.org, to see a copy of the order and other information on face coverings. Just a couple more comments before Dr. Saag comes up. I've done a lot of thinking about this. I've been getting a lot of input about this. Unfortunately, it's become a controversial issue, and it really should not. This is public health. This is science. This is doing what's right for our community based on the best information we have. about how to protect people from the spread of disease. I've heard a lot of concerns from people about their personal liberty. I've also heard a lot of concerns from people who do not feel safe going into public places, and they feel that their personal liberty has been limited because others are not wearing face coverings to keep them safe. In medicine, I think a lot about risk and benefit. We as doctors, when we prescribe a medicine, we think, does the medicine do more good or more harm? In this case, the medicine is a minor inconvenience for people to wear face coverings to protect each other and protect our community. The benefit is that we can potentially, according to the Institutes for Health Metrics and Evaluation, we could potentially reduce the transmission of COVID-19 by 50%. So to me, from a science standpoint, from a medical decision standpoint, and public health standpoint, it's an easy decision. I urge you all to cooperate. I urge the mayors of our cities to work with me. We all need to take this very seriously and do everything we can to get these numbers of COVID-19 cases moving back in the right direction. Thank you.
Thank you, Dr. Wilson. We're going to bring up Dr. Michael Saag now. He is a professor of medicine here at UAB in the Division of Infectious Diseases, and he's going to give an update on the status of the virus in our community and statewide and nationwide as well.
Well, thanks very much for having me here. I'm going to divide my comments into three areas. The first is, what do we do? What happens if we do nothing? The second is, what exactly do masks do? And the third thing is, what's the impact on our local community and our state if we comply and we follow these ordinances that just were announced? If we do nothing, the numbers will continue to go up. This virus is here, not going away. And nothing we can do about hoping and wishing is going to change that. Most of our citizens are still susceptible to the virus. Very few of us have actually been infected, myself included, but most of us have not. And the more we congregate, the more we get together, especially in indoor places, and we're not protecting our neighbors by wearing a mask, we just perpetuate the spread. This virus doesn't care about rules and ordinances. All it wants to do is infect people, and it's pretty good at it. One of the most infectious agents we've ever encountered. So doing nothing will keep our numbers rising. The last several days have had record numbers in Alabama and a number of other states. That's not going to stop. And you can just sort of imagine what happens as we get into July, August, September if we're doing nothing. So not only is there personal suffering by individuals who are infected and their families, especially if family members pass away, we also have a stress in our healthcare systems. Right now, we're starting to see, in parallel to the increasing number of cases, health systems being stretched. Now here at UAB, we're prepared, as are most hospitals, but at some point, for any hospital, that stretching of capacity ultimately gets to a point where a hospital or a health system is going to have a lot of problems managing the onslaught of patients. And that's not just COVID patients. Those are certainly a challenge for many reasons. But it also takes up space that other people who might have a heart attack or a burn or a motor vehicle accident will be looking for space in a hospital, and there may not be room at the end. And so it's not only the immediate effects of COVID on an individual who has it and gets sick, it's the secondary effects for the rest of us who might not get COVID. This is a call out to our community to come together, to be patriots, to do the right thing, not only to protect ourselves, but to protect our family and our community. So if we do nothing, continued rising cases and continued misery. A lot of us want to get rid of the stay-at-home orders, and we did. But frankly, I think we did a poor job of responding. We just said, okay, it's all over. We're going to go back to business as usual and the way it was in January of this year. That's not going to cut it. We've got to do more. Secondly, what do masks do? Generally what they do is they protect the environment from being contaminated by somebody who has infection. Every time a person who has this virus breathes, as they talk, the virus goes out further. If they're yelling or cheering, it goes out further, and if they're singing, perhaps even more. If they cough or sneeze, it can go out as far as 10 to 12 feet. So think of an infected person as someone who has a cloud around them. And if somebody comes by, they may breathe it in, but the real risk is if they're sitting down, conversing, no mask, and that cloud is consuming the table that they're at a restaurant or the space next to them at a bar. If there's no mask, that cloud goes unimpeded, and it's almost surely going to lead to infection of a neighbor just immediately next to them or maybe even 6 feet away. So what the mask does is it blocks the release of that virus into the environment. And to some degree, it helps the person wearing the mask maybe from breathing it in, but that's not the major focus. The major way this mask works is by protecting a neighbor. And you say, well, if I have symptoms, I'm going to stay home. Here's the bad news. A lot of the transmission is done when people don't have symptoms at all. Even among people who develop symptoms, their peak time of transmissibility is in the 24-hour period right before they get sick. And as we're finding with a lot of young people, they're getting infected, not developing hardly any symptoms, and then they come home and mom or dad or grandma or grandpa get infected because they're not wearing masks at home, and boom, you've got spread of the infection to people who are much more vulnerable. And that's not to say that young people don't get sick. They do. It's just their likelihood of getting very sick is small compared to older folks and those with underlying conditions. Finally, what's the impact if we follow Dr. Wilson's order the way it's meant to be? And I implore us to do this as good citizens. There have been projections about death in the coming months. And those death projections for the United States goes up to about 180,000 by the end of September. And for Alabama, that number goes up to about 3,000 or 2,000 or so. So 2,000 new deaths between now and that time if we don't do anything. In Alabama, if we wear a mask, we can drop that number to 1,300. Now, there's still going to be people dying, unfortunately. But think about this. You and me, we have the ability right now to prevent 700 people from dying in the next couple of months if we do what I would call a patriotic duty and protect our community and protect ourselves and our families. So please, it doesn't take much. Get a mask, wear it, and keep yourselves and your community safe.
We're actually going to keep you up,
Okay.
and we're going to start with some questions for you, and then we'll move back to Dr. Wilson. So the line is open. If somebody has a question for Dr. Saag, feel free to ask it now, and I'll try and moderate as I can. Does anyone? Yeah.
Yeah, hi, Dr. Saag, can you hear me?
Yes, thank you.
Yes, hi. My name's Brian Lyman. I'm a reporter with the Montgomery Advertiser. We're writing a story looking at Montgomery County continues to report a very high positive rate from test results. It's been hovering around 19% for almost 2 weeks now. Very broadly speaking, can you describe what a high positive return could mean for community transmission and just, I don't know if you can speak specifically to the Montgomery outbreak, but just like what having a high positive rate means overall for where the outbreak stands?
Sure. I'm really glad you asked that question because there's a lot of statements being made that more testing equals more cases, and if we cut back on testing, they won't have the cases. That's really not true. What the percent positive rate means is that of all the tests that are given, in your case, almost 1 in 5 or about 20% are testing positive. Why is that? Because we don't have enough tests. We're testing mostly people who are symptomatic. And as I mentioned earlier, a lot of people who don't have symptoms are not getting detected at all, yet they're spreading the virus further. The ideal number for the percent positive is around 1 to 2%, certainly less than 4 or 5%. We're not anywhere near that, for example, in Montgomery County. And so what it means is that, yes, we've increased tests. That statement is correct. But yet, despite increasing the number of tests, we still have a much larger number of people who are infected. So when you just go back to simple fractions from elementary school, if you increase the denominator, that is the number of tests, and the numerator stays the same, then the proportion is going to drop, the percentage is going to drop. But that's not what we're seeing. We're seeing the denominator increase, but the numerator, the top number, is getting even bigger. So despite testing more, we're not keeping up with the true number of cases. So now to Montgomery County, we have hot spots everywhere in Alabama. And I think all of us need to double down on, frankly, in my opinion, staying at home unless you have a good reason to go out. And sometimes mental health is a good reason to go out. You can go out, but be responsible. When you go out, avoid large crowds, especially a crowd that has a lot of people around who are not wearing masks. Wear a mask yourself when you go out, and keep your distance from other people. Those simple things, as Dr. Wilson said, will reduce transmission by 50%. But here's some bad news. The cases that we're going to see in the hospital, the cases we're going to see in Montgomery County and every county for that matter, 2 weeks from now were transmitted yesterday. So even if we did everything right starting right now, which we need to do, we're not going to see the impact of that until 3 weeks from now, where we might start seeing a level off and coming down. We've got a lot of work in front of us, and we've got to work as a community to make that happen.
Thanks for the question, Brian. Does anybody else have a question for Dr. Saag?
Hey, Chip Scarborough from Channel 13. Just wanted to ask your thoughts about Florida and Texas closing down all the bars, and do you find the bars a concern here? Is that something we need to look at as far as crowd control?
Well, I think everything's on the table from my perspective. And if I'm advising health officers like Dr. Wilson or Dr. Harris or others, I think we have to put public health number one. I'm all about the economy. I saw our suffering back in March and April, and it was painful to me and it was painful to all of us. But if we don't participate in mask wearing and doing everything we can as patriotic citizens to bring this under control, I'm afraid we're going to have to start drifting back toward more restrictions. And I think the first place that I would think of might be a bar or an indoor restaurant. Why? Because by definition, if you're drinking at a bar or you're eating at a restaurant, you can't do that through a mask. You can put the mask on, as Dr. Wilson's ordinances say today, you put the mask on when you're not eating and just talking. But by definition, it can't be on all the time. And even with 6 feet distance at a restaurant, we're still seeing some transmissions there. So that might be the next step. But let's try to make the mask work first.
Thanks, Chip. Does anybody else have a question for Dr. Saag?
Yeah, this is Sarah Whites-Kodachek with AL.com. I'm wondering about the hospitalizations increasing in the Birmingham area and what the hospitals are experiencing and what concerns you have, if any, for the weeks and months ahead if this rate of hospitalization continues to increase?
Well, I can tell you that every hospital in the Birmingham area, like most hospitals in the states, are being stretched now. And contingency plans are underway to absorb as best everyone can the onslaught of cases that we're very likely to see in the next 3 weeks. Even if we did everything right from here on, there's still going to be this bolus, this increase of cases coming to us. None of us know the degree. And frankly, as a healthcare worker, it's scary. I mean, it's really a frightening thought to think about what happens if any hospital, or one that I'm working in, might get stretched to the point where there's no room at the end. I'm here to help. I'm here to take care of people. But if I find myself in a position where there's just not enough space or equipment, and I'm not saying we're there yet, but it's a threat. And that's what keeps me up at night, is worrying about that. And that's why you hear the passion in my voice when I say, please, please work with us. Help us to mitigate this epidemic. We've never seen anything like this before, and it's really the unknown of what's going to happen in the next 2 to 3 months that's going to potentially be a make or break for all hospitals in our area. People talk about football. We really want to get back to that. Let me tell you, Hospitals, if they're being stretched and we're having an overflow and the epidemic's exploding, I'm not sure we can have any kind of normal activity, and that would include any kind of football or sports. So let's work together now to make it sure that we can do everything we want to do within reason.
Thank you for that question. Does anybody else have a question for Dr. Saag?
This is Morgan Hightower with WBRC Fox 6. Dr. Saag, just curious, and Dr. Wilson just said the order is going to be in effect until he deems, the public health has improved to the point where it's no longer necessary. In your medical opinion, how long do you think that will be?
I don't know. I really don't know. I don't think anybody does. And I think that's why it's wise for Dr. Wilson to kind of keep it open-ended. It really, bottom line, depends on us. How well do we respond as a community? If we do the right thing and we pull together and stop thinking of masks as some sort of political statement, for goodness sakes, think about it as the tool that it is. It helps keep us safe. And we need to do this together. And it's disheartening to me when I go from venue to venue in our community and I see less than 10% of people wearing masks in a crowded area. I'm just thinking, oh my goodness, we're going to be in trouble very soon. So let's change that behavior. And for now, I can't tell you what the future is. I can guess, and it doesn't look good when I'm guessing. So it looks a lot better when we're wearing masks, but we're just going to have to find out together.
Thanks, Morgan. Does anybody else have questions for Dr. Saag? We will have Dr. Wilson after this, but does anybody have questions for Dr. Saag?
Hey, it's Jack Royer from CBS 42. Dr. Saag, can you put a finer point on what you've learned about the virus since the beginning? You mentioned how transmittable it is, how deadly it is. Can you tell us what we've learned in terms of what's been worse than you thought about it from the beginning and what's been better about it in terms of transmissibility and things like that?
Thanks. I think it's important for us to keep historical context here. We have a disease that really wasn't described prior to December of 2019. And then by January, we knew it was here, and then we had tests available and even a treatment. And we didn't know how transmissible it was. When we were making predictions in March that actually were pretty accurate, we were assuming it had a certain level of transmissibility. But the truth is, it's, in my view, much more transmissible than I thought. And we can hear that from stories of young folks going to a bar in one of the college towns recently, and not only they're getting infected, but everyone they were with is infected. And then they go home, and I've taken care of a patient or two who got the infection from their parents. So it's much more transmissible than I thought. It's much more deadly than I thought. And let me just put an exclamation point on that. Picture yourself as a healthcare worker working in the hospital, and you're taking care of a patient who's in the intensive care unit. No family is allowed in the room. All they can do is communicate, be a conduit for that patient to that family through electronic media, be it FaceTime or or some sort of iPad. And the patient is all alone. And the healthcare worker, every time I go in the room, I've got to put on protective equipment. And every time I come out of the room, I've got to take it off. And each time, if there's a unit full of patients, which all of us have, that becomes problematic. That becomes stressful. Did I pick up that infection in that last encounter? But the worst thing is the emotional toll. Watching a person die alone and being the conduit between the family and the person who's passing away is a heavy burden. It's hard to do once, but when you do it over and over and over again, that takes an emotional toll. So it's not just space in the hospitals. It's not just, do we have enough protective equipment, which we do, fortunately. How do we deal with the emotional toll of this? And it doesn't seem to be ending. And then you walk out in the community and you see your fellow citizens with total disregard for this. Very demoralizing. So the things that surprise me is, frankly, the lack of public regard for this epidemic, the lack of cooperation in terms of protecting our community. Frankly, that's frustrating to me, and I'd like to see us change.
Thank you for that, Jack. Any other questions before we bring Dr. Wilson back up? Okay, thank you so much, Dr. Saag.
Thank you very much.
And we'll bring back up Dr. Wilson, who will answer some questions likely targeted at the ordinance. And then again, after him, we will bring up two guests who will share about their COVID-19 experience. Does anybody have a question they want to open with for Dr. Wilson?
Dr. Wilson, Jack Royer, CBS 42 again. With great respect, I'm curious, you talk about how this takes 2 to 3 weeks to see the results of a health order, of an action taken by the general public. Why wait until the numbers get bad to issue a face mask ordinance? And do you think it's necessary at the state level? Jefferson County has been ahead, it seems, of the state health officer on some of these orders. Why wait until the numbers are troubling to issue something that will take 3 weeks to see the results of? I just am curious about your process as a professional.
Yeah, thank you, Jack. That's a very good question, and I think an argument can be made for being proactive. In public health, we like to use prevention rather than being reactive. I've been thinking about this for quite some time. We've been making recommendations, strong recommendations, public media campaigns to encourage the public to wear face coverings. We've been doing that for several weeks. Frankly, I've found that we're losing the support of the public. People are getting careless. So I've been very reluctant to issue an order because orders are not popular. Unfortunately, this particular topic has become very political, very divisive, which is rather bewildering, frankly. So I've been kind of slow on this one. I've gotten a lot of input from our political leaders, from some of the people in the business community, and just been thinking about this very, very carefully before I acted. So for anybody who thinks that I've been rash, I don't think you could accuse me of that, because I've taken a lot of time on this particular decision, and I could be criticized for not acting sooner. But at least we're doing something now. I think it would be great if this could be done statewide. The entire state of Alabama is in trouble, and so I hope that maybe we can get to that point. We just have to have buy-in from everyone, whether there's an order or not.
Thank you, Jack. Does anybody else have a question?
This is Morgan Hightower with Fox 6. Dr. Wilson, just curious how you came up with this list of exceptions, especially churches where we know just by the very nature of places of worship, people are close together, and we have seen some major outbreaks in the state start in churches.
Yeah, Morgan, thanks. That's a very good question, and we did do orders early on that affected churches. I've been working a lot with churches. We put out a lot of recommendations for them, trying to be a little bit more careful around the area of religious freedom. And so I just decided to give a little bit more latitude there. I think churches also have more flexibility in terms of online services, so that there is more of an option for most churches for people to stay home and make that decision for themselves. So at this point, I'm just making it a strong recommendation, as I have before, that people do use face coverings in churches, at least in certain situations. As I mentioned earlier, the singing, the speaking in groups, areas where people are going to naturally congregate. So I think it's extremely important. The fact that it's not in the order doesn't mean it's not really important. I'm very concerned about churches and other gathering places like that. But we're just trying to be, in this order, I just try to be a little bit careful to strike a balance, between restrictions versus freedoms. And the area of religious freedom is an area I chose not to be quite as prescriptive at this time.
Thanks, Morgan.
Hey, Dr. Wilson, Chip Scarborough from Channel 13. Don't want to get too ahead of ourselves, but was just curious about your thoughts about schools opening back up in August, when right now at the end of June, about 6 weeks away, we are seeing this dramatic increase in cases.
Yeah, thank you, Chip. Yeah, that's a concern. The reopening of schools makes me pretty nervous. Fortunately, a lot of our school systems, I think virtually all of our school systems, are being very proactive. They've been planning for quite some time and thinking about this. Our health department's been advising a lot of them. Some of the other expert infectious disease and epi people in our community have also been advising some of them. I do think, and one reason I left the schools out of this order was I do think that educating our children is a very special situation. There are people that were concerned that I was going to impose too many restrictions on schools, and that's something I left open for now, just because. I want the public to know that I personally am very concerned about the education of our children. I think it's extremely important. It's important for the children's health to get an education. It's important for their future and their future health. There's also evolving information just about how infectious children might be. We certainly know that children are much lower risk to get into serious trouble or die from this. So I think that we need ongoing discussions about that. It's complicated for sure.
Thanks, Chip. Another question for Dr. Wilson. Do we have any other questions for Dr. Wilson? Okay, we will.
Sorry,
yes.
Savannah. I have another question,
Yeah.
but I just was waiting to see if someone else was going to say something. This is Morgan with Fox 6 again. Dr. Wilson, for those who still, they're obviously you're having to issue this order in part because people are not taking the suggestion from you and from other infectious disease experts to wear their masks. But for those who are still for those who are still not wearing their masks, not convinced that it's necessary during this pandemic, what is your message to them?
Well, my message to them is just, first of all, this isn't just about you. I think that's been missed here, at least from I've been hearing from a lot of different people, those that are for this and those that are against this, because it's been pretty widely known that I've been considering this order for the last couple of weeks. But what I keep hearing is people saying it should be my decision about what I do. It's my life. I should be free to do, make my own choices. And I'm afraid that people are failing to recognize it's not just about you, it's about us. It's about caring for others. Dr. Saag said it's patriotic. I agree with that. I think it's also just basic kindness and decency for our brothers and sisters in our community. So I'm having a little trouble understanding the mindset. I just really implore people to care about other folks, and that's what this is about. And let me just add, one reason we have our friends, who I'm very grateful for coming here today to talk about their personal experience, is I also think that one issue has been that some people in our community have not been touched by COVID-19, not yet anyway. And I think it's human nature. If we were raising the alarm bells back in early March, and for some people it's like, well, I don't see a problem. It hasn't affected me. It hasn't affected my family. I think that just naturally people start to let down their guard, and they think, well, maybe it's not such a big deal after all. My giving you the statistics over and over again, after a while, we get numb to that because it's just numbers. So what we want to emphasize today is this is about people. This is about family members. This is about our neighbors. And I want us to really, really understand that. Thank you.
Thank you. We're going to welcome up now the first guest of ours, Cindy Wisenat, and she has experience with COVID-19, and she'll share her testimony with you all now. After she finishes speaking, if you do have a question for her, we can open it up, but we'll let her give her story.
Hello, and thank you for giving me your time. I'm here because COVID-19 has affected me personally. In early early April, my aunt, who is just a pillar of our family, Eloise Wissenat. She's Aunt Weeze. She's Miss Weeze. If you had a dress, a wedding dress, a prom dress in the 70s, 80s, 90s, early 2000s, and you lived in Etowah County, she did it. She's the lady that you see every Sunday morning getting ready to go teach Sunday school class. She's the lady that you see every week at the grocery store, in her flower bed, talking to her neighbors. Everybody knows Aunt Weeze. So at 72, when she was exposed to COVID, and we had no idea if she would be able to survive the disease, it was so frightening. Luckily, prayerfully, she came through that, and she did recover, is recovering, I should say. So imagine then, fast forward to this past Monday, when my sister, who was my first playmate, my best friend growing up, was diagnosed with COVID. She's also a frontline worker. She's a registered nurse. And she was diagnosed with COVID. Now, it's even more real. Because not only is she someone, she's not someone older in the community. She's younger than I am. She's the person that always has a joke for you when you don't have one. She's the meanest person I knew growing up too, but what sibling isn't, you know? She's also the person that loves her grandchildren, is a great mother, is a good wife, is a good community member. She's the person that you call on when you need something, and she's the person that's caring for you at the bedside. And now she's affected. I was terrified. Our mother is in a nursing home. She couldn't visit her. She was visiting her for me because I happened to be immunosuppressed. I fought breast cancer this past year and was not deemed to be cancer-free until March the 6th, in the middle of COVID. So now my experience has been having to sit back and watch people be affected by this horrible disease and not understand why people in the community aren't taking it quite as seriously. You see, I'm the person that you'll see in the grocery store, and I'm the person that you'll see out spending time with my neighbors. But I can't do any of those things now safely if we're not going to wear a mask. And it's so not about politics. It's just about doing the right thing. It's about being there for each other, looking out for each other. And maybe we won't have to be in these very long, and maybe we will. Maybe it will be longer than is comfortable for a lot of people. And I get it. The economy, we need our jobs, but we need healthy workers. And if a mask will help us to have a healthy workforce, then I think we should just be there for each other and wear it. So if you don't think that you know anybody that has COVID, you probably have a church member or a grandmother or a grandfather that has high blood pressure or they have diabetes. Think about them when you don't wear your mask, because those are the people that you're not helping. You see, I wear my mask not just for me, but I'm wearing my mask for you. And all I'm asking is that we wear our mask for each other. Now, my experience with COVID has been limited to 2 people that I know, but those 2 people that I know have a greater effect on the whole community. When people didn't see Aunt Weeze or they didn't see Sophia, or they didn't have that contact with them, it was because of the virus. And we can simply wear a mask, just a mask. Social distance. And believe me, it's divisive in my house too. I have a 19-year-old. You know, she's very socially active. She wants to get out and do things, but she can't do it without a mask. Not under mama's rules. But I want you to meet someone else now. I want you to meet Jongeline Woods. We've been playmates from early age, and distant family members, and she didn't come out so lucky when it came to COVID and her experience. So I want her to talk to you about what she's experienced with COVID.
Thank you, Cindy. Now we have Jongeline up to speak.
Hello, I'm Jongeline Woods. On March the 30th, I took my father to his medical doctor about 8 o'clock that morning. He was really sick. Of course, you couldn't go into the doctor's office, so they checked the temperature. His temperature was normal. I sat outside, and I actually had on a mask in the car. And I sat outside and waited for him to come out. Well, we went and got his prescriptions. I took him home to give him some soup so he could eat his, so he can take his meds. Well, he could only take one bite, and he laid his head on the table. He was very weak, so my sister, Cece, and my mom was there, and I had just got my mom out the hospital the day before. And they were like, take him to the emergency room. I took him to the emergency room. They checked his temperature. He didn't have one. He was just very weak. So that was on a Monday, March 30th. On a Wednesday, well, previous to that, my nephew, my oldest sister, Cece's baby boy, he wasn't feeling well. He went to the urgent care that Sunday on the 29th. They said it had upper respiratory. Okay, Wednesday, April the 1st, my sister that lives in Saag, she came. We told her to come to the doctor in Gaston because theirs was closed. They told her she had, I think, upper respiratory and something else, something else. But they wouldn't give her a COVID test because they said they only had 3, and they needed to give to someone with symptoms. Well, she had fever, she had coughing, she had all the symptoms. She had everything. So they had just opened up a testing site that Wednesday in Rainbow City. So myself, my mom, my younger sister Kyra, my oldest sister Cece, her husband Tyrone, their son, their baby boy Tyrone Jr., we all went and got tested on the 1st. On the 3rd, I get the first phone call, and they said that I tested positive. Well, I had no symptoms that day. So the next couple of days, that Saturday, they called everyone else. But by that Saturday, I lost taste and smell. My nephew, that Saturday, we took him to the emergency room. They kept him. He had pneumonia. That Sunday, my oldest sister, Cece, went to the emergency room. They released her. That Monday, she went back because her breathing got more shallow. And they kept her that Monday. That Tuesday, myself and my younger sister went to the emergency room. I'm still not sick, just no taste or smell. But my younger sister was very sick. And I said, I'll go with you just in case they keep us in the hospital so we'll all be there together. Because she was afraid. Well, they told me I was fine. They did a chest x-ray, gave me a breathing treatment, and they were going to keep her. But she said, no, I want to go home. So my medical doctor called me for, I guess, a telehealth checkup. And I told her I was tested positive. She said, well, if you make it by day 10, you'll be okay. Well, day 9, I started getting sick. I started coughing. Mind you, at this particular time, my dad and my oldest sister are in the hospital. My nephew, her son, got out the day that she was put in the hospital on the 6th of April. Well, anyway, fast forward. My baby sister, Kyra, took me to the emergency room that Saturday. They kept me. I had multifocal pneumonia. I've never been sick, never had pneumonia, never been hospitalized. My sister, in turn, calls me while I'm in the emergency room. She said, I'm bringing Mama to the emergency room because she needs to make sure she's okay. They admitted my mom. So by this time, I think that, I take it back, that Wednesday the 1st, my dad's nephew, Michael Woods, ended up being hospitalized by way of ambulance. He tested positive. Okay, going forward, by this time, me, my mom, my dad, my oldest sister, and my cousin, we're all in the hospital at the same time. Well, that Saturday on the 11th, we were admitted. That Monday, my oldest sister, Cece, passed. on that Monday. That Tuesday, me and my mom were released. My dad is still in the hospital on the ventilator. Also, my oldest sister, Cece, that passed, she was on the ventilator. My cousin, Michael Woods, was on the ventilator. I didn't have to get on the ventilator, but me and my mom were released on that Tuesday. My sister died that Monday. That Saturday, the 18th, my dad passed. An hour later, his nephew passed. I don't think I slept the 4 days I was in the hospital because I've never been sick and all the symptoms that I had. And the thought of my sister passing and I could get worse, it was horrifying. But the message that I want to send across, and honestly, I wasn't going to come because I said people are not listening. But I think God afforded me this opportunity. I had just said yesterday I'm not doing another interview, but I think God afforded me an opportunity, one more chance to warn. Please wear your mask. I still don't go into stores because when I attempted to go into stores, once I got my 2 negatives, no one was wearing masks. No one, and just like Dr. Saag said, it's insulting to me. It's insulting to me. And I try not to take it personal because everyone is doing what they're wanting to do. But to lose 3 family members in 5 days, and at the time of the funeral, I'm still sick. I'm still positive. My family is still positive with COVID, and we had to bury 3 family members. No one could come to the funeral. We were able to attend, spread out, but the thought, they thinking it's over, it's not even a tip of the iceberg. And the way the cases are rising because no one thinks it's real. And it's not, as my friends say, it doesn't mean anything until it means something to you. If you're not affected by it directly, it really don't mean anything to you. So I plead with you to please wear your mask. Please cover it, just like Dr. said. It's not just for you, it's for people around you. Be thoughtful enough and care enough about people around you not to infect anybody else, because there's so many asymptomatic people that are carriers that are infecting other people and they're not aware of it. So I just plead with you and everyone to please wear your mask. Please watch your surroundings. And if, like Dr. Saag said, if you don't have to be out, don't be out. I order groceries and pick them up and they put them in the car. I still don't go nowhere. And honestly, I have antibodies and I have immunity, but I still don't trust it because this is still new to everybody. So the message that we want to send to everyone, I don't want anybody else to lose family members, especially 3 at one time. 3, it could have been all 9 of us, but God saw fit for us to still be here, and we're here for a reason. So just please wear your mask and be cautious of everyone else around you. If you don't care anything about yourself, care about your neighbors and your peers and your neighborhood. Thank you.
That is going to conclude today's news briefing. We will make this available to all outlets, a recording here in just a few minutes. I want to thank Dr. Saag and Dr. Wilson for their time and their expertise, and for Cindy and John Jolene for sharing their stories, very personal and hopefully resonate with people at home. Thank you for joining us.